Louise, welcome, and thank you very much for being with us. I'll give you the floor because you wanted to give us an update on the new evacuation orders from Eastern Khan Yunis. Please.
Yes, thank you. So in Eastern Khan Yunis, there were new evacuation orders, displacement orders issued last night. Already on the ground, we have seen people moving, families moving, people starting to pack up their belongings and try and leave this area. UNRWA estimates that around 250,000 people have been impacted by these orders. Of course, as usual, we expect these numbers to grow, but for us, this is it's another devastating blow to the humanitarian response here. It's another devastating blow for the people and the families on the ground. It seems that they are forcibly being displaced again and again. Making these decisions is now impossible. How do parents decide where to go? Where is there to go? Already in our drive this morning, just through the middle Gaza area, along the coastal road, you can see the makeshift shelters right up to the shoreline, right up to the water coming in. It is absolutely packed with family who have already had to move. Khan Yunis just a few weeks ago was a ghost town. I was there myself. It was completely empty because there's so much damage and destruction in this area. There is so limited infrastructure in terms of water availability, in terms of resources. And after the Rafah incursion and military operation there, that is what forced families back into this area. And now already, because of the orders last night, these same families are having to move again. Where do they go? We do not have this answer. There is absolutely no safe place in the Gaza Strip. This is something we have maintained for the duration of this war. But really, physical space we're talking about now. Where do these families go? Where can they physically go? Families in the Gaza Strip are trapped here. There is not an option to leave. There is so much military operations in the north, from Beit Hanun to Gaza City. In the middle area last night, we had bombardments all through the night. We had airstrikes very near to where we are staying ourselves in the Nusayriya area. We have bombardments in Khan Yunis and in Rafah. With all of this military operation ongoing, it is very difficult for families to make this decision. It's a very highly active military zone. There is no safety to leave. And as UNICEF reported earlier in the year, 17,000 children are unaccompanied or separated. What about these children? What decisions are these children making? What about the elderly? What about the sick? It is over 30 degrees Celsius here every day. There is very limited availability for fresh drinking water. It is not easy for anyone of full health to be able to be making such a move in the circumstances that we are facing now. There is trash everywhere. There is disease spreading. The options on the ground are very, very difficult for families and for people here to be making. So I'll leave it there and thank you for having me today and over to any questions.
Thank you very much, Louise, for coming and briefing us. I'll open the floor to questions now. And again, as I said, Margaret's there if you needed to ask her anything. I don't see, yes, Emma Farge, Reuters.
Hi, Louise. Thanks for briefing us again. You mentioned 250,000 had been impacted by these orders. What does that mean? And do you have a count for the newly displaced within sort of 24 hours? Do you know roughly how many people have been newly displaced? Any update on the fuel situation? I know your operations were grounded for a while over the last week. Have you got any in and can you operate? Thank you.
Louise?
So, yes, thank you. So these recent orders came through overnight. We mobilized teams almost immediately to the areas and we are trying to get some kind of count on. So we will be reporting those counts. If you keep watch of the UNRWA Twitter feed, that will update with the most recent numbers. 250,000 is our estimate for the entire area impacted, but we will be updating regularly with the numbers of people moving throughout the coming days. In terms of the fuel, yes, we did receive some fuel. It was 2 days ago we received some fuel, so we have now some limited fuel for the vehicles. diesel and fuel is both still restricted. We're still, operating on a day-by-day basis, and it really restricts the humanitarian response when we don't have the ability to plan long-term, knowing when we will receive fuel, knowing how much fuel will reach us, in order to keep, hospital generators running, desalination plants, and of course, the fuel for our vehicles as well. So, as always, we are really living hand to mouth in this humanitarian response. And just to add that the most recent evacuation orders will severely impact our ability to reach the Kerem Shalom crossing as well. This area is where we have been driving through. Of course, we used to be based in Rafah until the military operations there. We have now since been operating out of Nusayrat, but to get to the Kerem Shalom crossing with the aid, we do travel through Khan Yunis. So this evacuation order also impacts our ability to receive aid and distribute aid to the population.
Very clear. Other question in the room before I go to the platform? No? Okay. Antonio Brozzo, the Spanish news agency.
Hello. So can you tell us which direction are these evacuees going, and are they going south to Rafah, which also had some evacuation orders in recent weeks, or are they going to the coast? If you have more information. And also, I know it's difficult, but the total of people that have left Khan Yunis in recent months. Thank you.
So this is, a family by family basis. When the Rafah military operation began, people were making decisions based on what they could do, how far they could move as family. Like I said, there's people with the elderly, people with the sick. So for each family, they will be making decisions based on what they can do themselves, maybe where they have other family. Our understanding so far is people are going towards the west, so that is towards the coast. But we will have more information on this throughout the day and as this unfolds. And we also have a lack of, as we have for 8 months, a severe lack of communications on the ground. So even to communicate with our own staff who are currently out reporting on this, it's very difficult for us to receive this information, even those ourselves in Gaza in real time, because the comms continuously cuts out because of the fuel restrictions that we have. So all of these things they're not only impacting our ability to have the humanitarian response, but also our reporting and communications among each other becomes very difficult. So as I said, as soon as we have more information on this, we will be sharing across our platforms. In terms of the numbers from Khan Yunis, this is something I will be able to look up and get back to you on. But there were 1.4 million people originally in Rafah before May 6th. These people, relocated to various areas, including Khan Yunis, and now again in Khan Yunis, 250,000 people impacted by the current evacuation orders there.
Thank you very much, Louise. I see Margaret wants to add something, and I see Richard Peppercorn is now just connected. Margaret, you want to say something on the question of Antonio?
Well, I was going to actually give a quick update on the health situation because I was concerned that my colleagues would not make it in time given the logistical difficulties. But if Dr. Peppercorn's joined already, I was just going to give a very quick update on the situation in the health situation, that the system's lost 70% of its bed capacity. There are no functioning hospitals in Rafah for the third consecutive week, except for the ICRC field hospital, and fuel shortages, as Antonio asked, are impacting health functionality drastically. The generators at the hospitals are barely functioning as they've been operating overtime, and the limited access to electricity, fuel, and solar system hinders the proper functioning of health facilities and aid operations. Power blackouts particularly affect newborn and ICU services and kidney dialysis, putting people who are desperately ill, critically ill, at risk. But if Dr. Peppercorn's joined and we've got Dr. Balhi, I will hand it over to them.
Thank you very much, Margaret. Yes, I see Richard. Don't see the other colleague, but maybe they're in the same room. I don't know. But in any case, just before I give the floor to Rick, Just if there is any other specific question to Louise on what she just told us. I don't see any. So, Louise, if you can and want to stay, please do. And now we will listen to the other colleagues from WHO. So we have Eric, doesn't need to be introduced, of course, but I see also another colleague who has joined, maybe it's Dr. Hanan Balki. Is that, yes, I see her nodding. So Dr. Balki, as I said, is the regional director for the Eastern Mediterranean for WHO. So I don't know who would like to start to give us an update on the health situation. I think you're just coming out of a hospital right there. So
Thank you very much. I will go first, Rick, and then I will hand over to you. Thank you so much. Thank you very much. And again, sorry a little bit for the slight delay that we had. It's a pleasure to be with you today. I think.
We can hear you, madam.
Okay. I arrived, of course, to the occupied Palestinian territory on Sunday with the goal of gaining some first-hand insights into the scale of the health crisis, most pronounced, of course, in Gaza and escalating in the West Bank. When I took office as the regional director in February this year, the crisis in Gaza had already reached catastrophic levels. Today, the situation continues to deteriorate rapidly. In my meetings with partners and senior UN officials on Sunday and yesterday one message was clear. WHO and humanitarian partners are committed to staying and delivering in Gaza. We have the capacity and the resources needed to alleviate the catastrophic suffering of the people in Gaza that are facing, but lack an enabling environment to expand our operations is one of our biggest challenges. So we need peace and we need sustained humanitarian access. Against all odds, the WHO teams are working tirelessly to save lives and resuscitate and restore the Gaza health system. To date, WHO has procured $30 million worth of medicines and medical supplies, 59% of which has already been delivered to the Gaza Strip. We have also provided and continue efforts to provide fuel to hospitals in dire need. International emergency medical teams coordinated by WHO have conducted around 900,000 medical consultations and 25,000 surgical operations in 2024. Medical evacuation of 4,913 patients outside Gaza have been supported by WHO and partners. Together with them, we have also worked to restore Nasser Medical Complex and Shifa Hospital and specialized services such as dialysis, emergency care, surgery, orthopedics, burn care, laboratory services, and maternity and pediatric care. But these efforts, faced with obstructions, denials, delays, and great risk to the safety of our own teams, cannot replace a well-functioning health system that is so desperately needed in Gaza today. Until a sustainable solution to this crisis is found, our work will continue to face challenges. One key challenge is shortage of fuel, which is needed to keep all humanitarian operations, including health, running at the needed capacity. Since the closure of the Rafah border, which was the main entry point for fuel into Gaza, our health response operations have been significantly compromised. From 25 to 27th of June, only 200,000 liters of fuel entered Gaza via Karam Abu Salim, Karam Shalom border to be shared by all sectors, including health, wash, nutrition, and others. Since then, no fuel has entered Gaza. To maintain full operations, health alone needs 80,000 liters of fuel a day. The water and sanitation sector alone needs another 70,000 liters of fuel a day to operate critical services that remain accessible. As a result, hospitals are once again short on fuel, risking disruption to critical services. Injured people are dying because ambulance services are facing delays due to shortage of fuel. Fuel shortages are also affecting essential water and sanitation services, such as water delivery, sewage pumping, trash collection. So from June 15 to 23rd, the water and sanitation cluster received less than 5% of the fuel needed each day to keep these services running. As a result, water service providers are forced to ration operations of municipal groundwater wells and the 2 working water desalination plants, reducing water production even more. Lack of safe water and sanitation is significantly contributing to the spread of diseases. There are concerning increases in the number of adults and children suffering from waterborne diseases such as hepatitis A, diarrheal illnesses, skin conditions, and others. This situation must be prevented from worsening, potentially leading to devastating consequences. Closure of the Rafah border crossing is also preventing critically ill patients from receiving the specialized medical care they need outside Gaza. While a few patients were able to be evacuated recently via Karam Abu Salem, more than 10,000 patients remain stranded inside the strip waiting to be evacuated. Medical evacuation corridors must be urgently established for the sustained, organized, safe and timely passage of critically ill patients from Gaza via all possible routes. This includes Rafah, Karam Shalom to Egypt, West Bank, East Jerusalem, and from there to other countries when needed. At Al Maqasid Hospital in East Jerusalem yesterday, where I visited, the hospital director told me that the facility is ready to receive up to 100 patients from Gaza as soon as they can be medically evacuated. The hospital has the capacity today to provide specialized services for even the most critical cases. Patients in Gaza should have timely access to the medical care they need and that can be provided and is available less than 1 hour away. At the hospital, I saw triplets, almost 10 months old, who were born prematurely before the war in Gaza. Their mother had to travel to Gaza to take care of her other children since the infants needed extended care in the incubator. So they were alone in the neonatal care area. Once we started, she was unable, once the war started, she was unable to return to Al Maqasid and has not seen her babies since. And that was quite heartbreaking. I also saw a boy scheduled for surgery for hydrocephalus, which his parents and siblings remain in Gaza, unable to be with him. These are some of just the realities and not the worst case realities on the restrictions of access and their consequences. Over the coming days, I hope to visit the West Bank, where the situation is becoming increasingly volatile. Attacks on healthcare have reached alarming levels, and access to healthcare is further impacting health service and delivery. The need for a sustainable solution in the occupied Palestinian territory is more urgent than ever. Despite the challenges, WHO and our partners are unwavering in their commitment to provide critical health services. However, a long-term solution to this crisis requires concerted effort from all international communities to resume and continue with political discussions to address the root causes of this conflict and to create peace today. The implications of the crisis extend beyond Gaza and the West Bank, impacting regional health security as hostilities also escalate in Lebanon and Syria. Only through collective action can we ensure that people receive the health care they desperately need and deserve today. Once again, we need peace today to secure access for all the people within Gaza, the West Bank, and to save the fragile healthcare systems that exist in the neighboring countries and in many within the region. Thank you for your continued support and dedication to this cause, and over to you.
Okay, thank you very much, Madam. Thank you. And I understand Rick Pieperkorn has something to add about the visit to the hospital right now.
Thank you very much. And thank you very much also, Dr. Hanan. I will focus on three areas. First, of course, the European Gaza hospital. So we've seen, and all of you have witnessed the latest evacuation orders in Khan Yunis. And it includes the European Gaza hospital area. And I want to stress, though, the hospital itself is not under evacuation order. A hospital like that is like an island. And I think the health workers, unfortunately, have witnessed several times that when then military activities expand around that hospital, first of all, health workers live often close, cannot come. No, they have evacuated. So they cannot come to the hospital. Patients cannot access, ambulance can access. We, WHO, cannot come with medical supplies, fuel, water, etc. So very quickly, that hospitals, what we've seen over time, they become from partly functional, non-functional. And this time, the hospital staff and the patients, they decided to already evacuate themselves. Very sad. Yesterday, reportedly, 270 patients self-evacuated along with medical staff, mainly to the Nasser Medical Complex. This morning, more patients were evacuated, and only 3 patients remain at the moment at the European Gaza Hospital, and 3 in the ICC field hospital. So the majority of the patients have been referred to Nasser Medical Complex. The hospital, Ministry of Health, they have requested to transfer now valuable medical equipment and supplies out of the hospital. So WHO will be trying to support and will be supporting this mission whenever that is feasible. And again, European Gaza was one of the few remaining key referral hospitals south of Wadi Gaza, where the majority of the population is 1.9 million. On Nasser Medical Complex, so hospital, which we know became non-functional and then incredibly work resilience for the Gazan health workers together with WHO and partners make it partly functional again. The hospital is already overwhelmed, needs more fuel. WHO is trying to resupply the hospital and also help to expand the bed capacity with another 100 beds on top of the current capacity, 450 beds. So that called me to the hospital functionality. Currently, 16 out of 36 hospitals partly functional, 43 out of 99 primary healthcare centers partly functional. From the field hospitals, 8 of the 10 field hospitals are functional, 4 fully, 4 partially. And I want to stress on the partly functional hospital, 12 are partially accessible due to insecurity, physical barriers, and damage. And also, it even gives a better picture than it really is, because the larger hospitals, as Shiva, as we know, they are not non-functional. The only functional is a trauma stabilization point, and that's where most hospital beds are. Last point is on fuel, and this is important not only just for health. So based on our data, from 25 to 27 June, only 195,200 liters of fuel entered Gaza via Kerem Shalom border, to be shared by all sectors, so that includes health, but also wash, nutrition. Think about bakeries and others. So since then, no fuel has actually entered Gaza. WHO actually delivered to Kamal Adwan only 10,000 for it to remain partly functional. All hospitals are also in some areas partly hospital because of the lack of fuel. They have to save on fuel constantly. The water and sanitation, the wash sector alone needs 70,000 liters of fuel a day, and the health sector needs 80,000 fuel per day to operate critical services. So as a result, once again, short and full, risking disruption of critical servers, injured people, etc., and morbidity and unnecessary morbidity and mortality. Ambulance services, of course, delays during shortage of fuel as well. So it's affecting all. WHO is trying to keep hospitals resupplied with fuel and medical supplies, but the lack of fuel has and is compromising our operation, is actually compromising all humanitarian operation. And the latest fuel we delivered was on 29th of June, the 10,000 liters of fuel come out of one. And it is, of course, quite striking that 9 months in this crisis, we still talk about something basic as fuel. Thank you very much for your attention. Over to you.
Indeed, you're absolutely right. Okay, so let's see if there are any questions. I think you've been extremely exhaustive. Don't see any hand up in the room. The Spanish news agency, Antonio Broto on the line. Antonio?
Thank you. My question is for Ms. Balki. I would like to know if the attacks to health installations in Gaza have been reduced in the recent weeks, and if it happens that this is the case, if the situation on health services is also improving. Thank you.
Dr. Balki?
Yes, thank you very much. I'll take the beginning, Miriam, then I'll hand it over to Rick for more details. Of course, the health situation and the health infrastructure and services have been extremely damaged and destructed. But I will hand it over to Rick for the actual details of the numbers. Over to you, Rick.
So, of course, and key ask, and as well, we've seen the evacuation orders, so that's very likely there will be military activities in that area around Khan Yunis. So we plead, I mean, that the European Gaza hospital will be spared, will be not damaged. I mean, and I cannot say that over the last week we have not seen more attacks on healthcare. I just want to say WHO, because I think it's always a little bit confusing about that. So WHO is mandated by the World Health Assembly, by all member states, to monitor, to analyze, and to report on attacks on healthcare. And that we're doing that in all conflicts, the acute conflicts, the chronic conflicts all over the world. And as of 25 June, if you look at the Gaza, we reported 474 health attacks. And related to that, 740 people were killed in those attacks, 961 people were injured in these attacks, and 128 health workers remain detained and arrested. We have seen 103 health facilities affected and 32 hospitals damaged. And besides that, 130 hospitals, ambulances affected, and 61 with sustained damage. Over to you.
Thank you very much. Any other question? Emma Farge, Reuters.
Thank you, Dr. Peppercorn. Just a clarification on the European Gaza hospital. Did the staff also leave along with the patients? And just more broadly in middle and southern areas of Gaza, how are the field hospitals coping? Because it seems to me they're trying to do the job of real hospitals with all of the equipment and infrastructure and personnel that they have. So how are they coping with this task of trying to replace them? Do they have what they need to do, for example, complicated surgery from the injuries coming in? How are they coping with that challenge? Thanks a lot.
Okay, thank you very much for the question. So, yes, most staff have left also the European Gaza hospital. As I said, there's still 3 patients remaining with some staff, and ICRC field hospital also reported to us have 3 patients as well. And I think the ICRC, what I understand, at least that's what I understood from yesterday evening, 10 ICRC staff are also still remaining in European Gaza or in the adjacent ICRC field hospital, which is part of the European Gaza complex. Now, you raised a good point. So first of all, I still think that what I said, that the partly functioning hospitals, and I described them to you, this is still so on the health functionality, the 16 out of the 36 hospitals, they provide still most of the of the secondary and referral care, including the 43 out of 99 primary healthcare services. The 8 out of the 10 field hospitals are incredibly important and unfortunately increasingly important. And 8 out of 10 where 4 are working fully and 4 partially. For example, if you look at Rafah, which used to have 3 hospitals, none of those 3 hospitals are functional. There's only 1 field hospital, ICOC field hospital, which is functioning in that area. Now, when you go to, so there's a few others, an UK Met field hospital, which is in Khan Yunis, in that field area, of course, the Jordanian hospital, and the IMC hospital in Deir Bala. There's a few other places where there's field hospitals. PRCS that's actually still one of the partly functioning hospitals as well. So there's a small string of field hospitals, mainly along the coast, and along the coast, and also assisting in the north. And yeah, they're becoming increasingly relevant. And some of the, like ICOC field hospital, UK Met field hospital, IMC field hospital, which are, I would say, the bigger field hospitals, they get a lot of referrals from other places. And we, as well, WHO, refer to that. All hospitals, including the field hospitals, they suffer from the same problems. They suffer from the lack of fuel as well, because we will help to provide, and including some of the medical supplies, consumable and essential medicines. Over to you.
Thank you very much. I don't see other hands up. So thank you very, very much for this really fresh briefing out of a... Oh, sorry, there is a last-minute hand from the AFP. Chris.
Thanks for taking my question. It was about the head of Al-Shifa doctor that has been liberated, I think, yesterday morning, and has accused the Israelis of having been tortured with other prisoners. I was just wondering if you had a chance to talk to him, to see him, to contact him, and can you give us any, if so, can you give us any idea of the allegations, if they're true? Thanks.
This question to me?
Yeah, I think he asked you, or whoever else in WHO wants to answer. I don't know if...
Yeah. I want to say, well, first of all, we welcome the release. We welcome the release. No, none of the WHO staff have actually talked to the doctor, to the director of Shifa. We remain concerned about the well-being of health workers that remain in detention, and we've been raising this for months, and of course, and not only we, many other organizations, UN has raised that. Not only concerned, we also call for their immediate release. Over to you.
I think Chris has a follow-up. No, it's okay. Okay, so that I think was the last question. Thank you very much, really, to Louise, to Margaret, of course, to Dr. Balki and to Rick for this update. And that leads me to our last 2 briefers. Catherine Wissou for UNCTAD.
Oui. Bonjour à tous. La CNUSED publie ce matin les derniers chiffres du commerce mondial pour le premier trimestre 2024 en comparaison avec le dernier trimestre 2023. On assiste à une croissance du commerce qui repasse au vert, donc avec plus 1% pour les échanges de biens et environ 1,5% pour les échanges de services. Cette croissance est alimentée principalement par la dynamique commerciale à l'œuvre aux États-Unis et dans les pays en développement, en particulier en Inde et en Chine, donc les grandes économies asiatiques en développement. Les prévisions de croissance du PIB mondial se maintiennent autour de 3% pour l'année 2024. Ces perspectives restant prudemment optimistes. Si ces tendances se maintiennent, le commerce mondial pourrait s'approcher du record qu'il avait atteint en 2022, à savoir 32 000 milliards de dollars. C'était donc le chiffre record de 2022. Le commerce dans les pays en développement et le commerce sud-sud ont augmenté, eux, de 2%, alors que les importations et les exportations dans les pays développés ont stagné à 1%. Donc les pays en développement font mieux que les pays développés. La croissance du commerce montre bien entendu des disparités selon les secteurs et les plus performants sont ceux qui sont liés à la production d'énergie verte et à l'intelligence artificielle. Par exemple, la valeur commerciale des serveurs de haute performance a augmenté de 25% par rapport à 2023 et la valeur commerciale des véhicules électriques est en hausse significative de 25%. Malgré ces tendances positives, la CNUSED met en garde et modère son enthousiasme, comme je le disais, sur le point suivant. Les risques géopolitiques associés à l'augmentation du coût des transports et la nouvelle focalisation sur les industries nationales pourraient modifier la structure du commerce mondial et en entraver la croissance. Le document vous a été envoyé vers 11h ce matin, donc vous l'avez en anglais, mes notes seront en anglais et les économistes qui ont produit ce Global Trade Update sont à votre disposition pour commentaires. Je voulais juste ajouter une annonce. La semaine prochaine, nous allons publier notre rapport sur l'économie numérique, donc 2024. Le message principal de ce rapport est qu'il est urgent d'adopter des stratégies durables tout au long du cycle de numérisation d'une économie. De l'extraction des matières premières à la production de déchets, en passant par l'utilisation de ces technologies numériques, le rapport explore pour la première fois la nature et l'ampleur de l'empreinte environnementale du secteur qui reste largement à évaluer. Il est évident que les pays en développement souffrent de manière disproportionnée des effets négatifs de la numérisation sur l'environnement, tout en ratant les opportunités de développement économique en raison de la fracture numérique. Donc la CNUSED appelle dans ce rapport à des politiques globales impliquant toutes les parties prenantes pour permettre une économie numérique plus circulaire et une réduction de l'empreinte environnementale de la numérisation tout en garantissant un développement inclusif. Ce rapport sera présenté en conférence de presse le 10 juillet. Je dois vous confirmer encore l'heure. L'agenda de la secrétaire générale est très chargé. On va vous confirmer ça, j'imagine, dans la journée. Et le dossier de presse sera sous embargo. J'espère l'avoir avant jeudi, en tout cas avant la fin de la semaine. Voilà, à suivre. Merci beaucoup.
Merci beaucoup, Catherine, et merci pour ta patience. C'était un long briefing, mais on a encore, je ne vois pas des mains. Non, donc on va aller à notre, merci beaucoup Catherine, à notre dernier speaker qui est online. Turn to David Hirsch. David, thanks for your patience. You also have a quick announcement of an event, I think in July.
Yeah, not at all. Thank you, Alessandra. Just an announcement that GIGA, the joint ITU UNICEF initiative, which aims to connect every school to the internet by 2030, will hold the first GIGA Connectivity Forum next week. Reporters are invited to cover the opening session of the GIGA Connectivity Forum in person on 9 July. That runs from 9 o'clock to about 12:30. Location is ITU headquarters. Advanced registration is required, but we will try to make that simple for you if we can. We would just request an email to pressreg@itu.int to request accreditation from that. At that event, high-level representatives from government ministries and experts from countries that are engaged with GIGA, the initiative, again, that aims to connect schools to the internet, and they'll share their experiences of how they've connected their schools to the internet.
Thank you very much. I see Emma has a question for you.
Thanks very much. It's actually about a meeting that took place at the ITU last week with the Radio Regulations Board. I'm just curious, now that that board has condemned Russia for its actions, its harmful interference in other countries' satellites, I'm just wondering, what could it potentially do? What tools does the ITU's RRB have at its disposal? Could it potentially sanction Russia down the line or exclude Russia? Are there any kind of things that it could actively, any steps it could actively do down the line? Thank you.
Yeah, so the Radio Regulations Board did meet last week, as it does up to about 4 times a year, 24th to 28th of June. It met in Geneva. The summary decisions of those meetings are available. And beyond that, there's really not much that I would offer beyond that. The decisions that the RRB have presented are listed in the summary of decisions, and those give you a sense of how the RRB works and how they kind of pursue these matters with the interest of ensuring that there's radio communications are free of harmful interference.
Thank you very much. Jamie, is that a question?
Yeah, I mean, if I could just follow up on that. I mean, I don't think you really answered Emma's question. She was trying to find out what tools that ITU has at its disposal to possibly enforce those decisions. Can you just tell us procedurally how that works?
Well, procedurally, the matters are raised before the board, the contributions are made, and those are listed on RRB's website. The RRB will take up matters that are presented to it during its sessions, and then it will release through the summary of decisions. As one looks at it, one can tell how the RRB kind of considers these matters and the types of provisions that it tries to provide for to settle any sort of matter between administrations. So the summary of decisions are fairly complete, and they do give a sense of how the RRB approaches its work to, again, ensure that radio communications run free of harmful interference.
You want to go ahead with it? No, it's okay? Okay. Thank you very much. Thanks, David. Thanks for your patience again. Just a very quick couple of announcements for the end. Just to remind you that the Human Rights Committee, which opened yesterday, its 141st session, will begin the exam of the report of Croatia this afternoon. And the other countries, that's what I wanted to give you. I don't know if you have already looked at the list of countries to be examined, to be looked at this session are Croatia, as I said, but Malta, Honduras, Maldives, Suriname, Syrian Arab Republic, and India. And in terms of press conferences, I remind you of the background briefing that the Human Rights High Commissioner Volker Turk will give on Wednesday, or 3rd of July at 10:30. This is in Palais Wilson. It's a background briefing again, but I think he will take a short Q&A on record at the end of the briefing. So that is at 10:30 at Palais Wilson, Salon des Dames. And then on Thursday, 4th of July at 2 p.m., the UNHCR, IOM, and the Mixed Migration Center will launch their new report on risk faced by refugees and migrants on the central Mediterranean route. The title is On This Journey, Nobody Cares If You Live or Die. Everything is under embargo until Friday, 5th of July at 10:30, and the speakers will be Vincent Cochetel, that you know well, the UNHCR Special Envoy for the Western and Central Mediterranean situation, Lawrence Hart, IOM Director of the Coordination Office for the Mediterranean and Chief of Mission for Italy and Malta, and representative for the Holy See, and Bram Fraus, the Director of the Mixed Migration Center. And as you have heard from Catherine, there will be a press conference on the 10th, but this we don't have the time yet. She will keep us updated. So if there are no other questions, I'd like to thank you all for following this very long briefing, very interesting briefing, and bon appétit, and I'll see you on Friday. Thank you.